Hello and welcome everybody to the first Psychosocial Health and Safety Forum for 2025. I'm Lachlan Abrahams, Assistant Director of Comcare's Education and Engagement Team, and I'll be your host for today's event. If you've previously attended a Comcare event, welcome back. And if this is your first time, it's great to have you with us. Firstly, on behalf of Comcare, I'd like to acknowledge the traditional custodians of the lands on which we are virtually meeting today. I'm joining you from Canberra, so I'd like to acknowledge the Ngunnawal people who are the traditional custodians of the lands that I'm grateful to be upon. I'd like to pay my respects to elders past and present and acknowledge the contribution they have made and continue to make. I also extend that respect to other Indigenous Australians and Torres Strait Islander people who are here with us today. Now, on to some housekeeping. The most common question we get asked is, will the session be recorded and available to watch later? Yes, rest assured, the recording will be available in the coming weeks on our website, and we will also send you an email to let you know when it's ready. In the meantime, the slides are available now. So, please note your microphone, camera and the chat are not available for this forum. The Q&A function is, however, available for those participating through Microsoft's Teams app, and we ask that you keep the discussion respectful and on topic. There is a pinned post that has links to our website for more information on psychosocial hazards in the form of fact sheets, e-learns, webinars and videos. The content and community discussion today will include psychosocial hazards and their impacts. And we've also included in the post some links to contact details should you need any support. We will also be using Mentimeter today to engage with you. So the QR code is available on your screen now and the link is pinned in the Q&A section. There's a current question in the Mentimeter at the moment for you to answer. Which health and safety jurisdiction are you in? So please feel free to complete it now and we'll come back to the others a bit later on. Now, the focus of today's forum is the Commonwealth Code of Practice on managing psychosocial hazards at work that was released late last year. Now, in a moment, I'm going to welcome Kathy Numchek, Assistant Director of Comcare's Psychosocial Regulation Team, to share an overview of the Commonwealth Code. Later, Rebecca Williams, a Senior Inspector, will provide an update on Comcare's Psychosocial Inspection Program. The questions asked when you registered has helped us inform the content of this session, and we welcome any new questions that you have to guide future forums and other content. The information provided today is aimed at those in the Commonwealth Health and Safety jurisdiction. Comcare is the regulator for the Commonwealth jurisdiction, which includes all federal government agencies and some national companies who are licensed to self-insure under the Commonwealth scheme. Each state and territory have separate work health and safety regulators. If you work for your state or territory government, local council or private enterprise, it's most likely that you'll be regulated by your state or territory regulator. If you're unsure, however, I recommend you look at the Safe Work Australia website for more information. Now, back to the forum. At the end of the presentations by Kathy and Rebecca, we're then going to hear from you with an interactive session using Mentimeter. But before that, let's hand over to Kathy to get us started. Welcome, Kathy.
Thanks, Lachlan. Morning all. I'm coming to you from the land of the Wurundjeri people. As Lachlan mentioned, I'm Kathy, Assistant Director in the Psychosocial Regulation Team, and I oversee the delivery of Comcare's Psychosocial Inspection Program. Over the next 20 minutes or so, I will provide a quick update regarding psychosocial regulation at Comcare and a brief overview of some key points in the Commonwealth Code of Practice. Comcare's purpose is to promote and enable safe and healthy work. Comcare's strategic priorities are to prevent work-related injuries and deliver better return to work outcomes. A bit of a fun fact, we have just under 500,000 workers that fall within our jurisdiction, and 52% of who we regulate are within the public service sector. Psychosocial regulation is core to Comcare's regulatory function, particularly given the evidence behind psychological injuries, that they have longer recovery times, higher costs, and require more time away from work. Psychosocial hazards are prevalent across all Australian jurisdiction, including the Commonwealths. When comparing last financial year to the previous one, incidents reported to Comcare involving psychosocial hazards increased by 59%, and notifiable incidents involving psychosocial hazard increased by 79%. In the last financial year, 44% of all work health and safety concerns reported to Comcare were of a psychosocial nature, and 12% of accepted compensation claims were for psychological injury. Some of the most common psychosocial hazards we see reported include job demands and bullying. In response to reported incidents and concerns, Comcare inspectors take necessary action in accordance with our compliance and enforcement policy, which is available for anyone to view via our website. Monitoring compliance activities are the most common response tool, and this includes a Comcare inspector conducting an inspection to assess whether or not a PCBU is compliant with their legal obligations. We may use statutory tools such as improvement notices or prohibition notices from there on as deemed necessary. A proactive focus on psychosocial hazards continues to be a regulatory priority, and this year we are very excited to be formally launching our Psychosocial Inspection Program, which Rebecca from our team will run you through shortly. To ensure we have a shared understanding, let's start with a very quick overview of the legislation we work from. So Comcare administers the Commonwealth Work Health and Safety Act and regulations. The Act outlines the legal duties and responsibilities required of a duty holder, and it includes psychological health in its definition of health. The regulations complement the Act as they set out specific requirements and how to comply with the legal duties under the Act. In April 2023, new regulations were introduced and for the first time set out how employers must identify and manage hazards and risks to workers' psychological health and safety at work. Prior to this time, there were no regulations that specified these requirements, which resulted in a lack of clarity as to how risks to psychological health in the workplace should be managed. Luckily, the amendments to the regulations make it very clear. There are 4 specific regulations relating to psychosocial hazards. These are known as Regulations 55A to D, and I encourage you to have a look. It's not a long read, and a quick way to find them is to jump into the regulations and search for the word psychosocial. I saw some great questions that came through in the event registration about the various definitions in the psychosocial space, so I thought we could quickly go through these together, starting off with the ones in the regulations themselves. Regulation 55A defines a psychosocial hazard. It defines it as a hazard that arises from or relates to the design of work, work environment, plant or workplace interactions or behaviours, and may cause psychological harm, whether or not it may also cause physical harm. Regulation 55B then defines the meaning of a psychosocial risk. This being the risk to health or safety of a worker or another person arising from a psychosocial hazard. Now, further to the questions about definitions, in a work health and safety context, these 3 terms on the screen have different meanings. Because they are so similar, there is often confusion about them. The legislation does not define these terms. However, it is generally accepted that psychosocial safety refers to the broader work environment that supports mental, emotional, and physical health at work, and this includes the management of psychosocial hazards. Psychological safety, on the other hand, refers to an individual's belief that they can speak up and raise concerns within the workplace without fear of negative consequences. Then, psychological health and safety encompasses the overall state of mental health and well-being of an individual at work, and this can be influenced by both psychosocial and psychological safety. Now, before we dive into discussing the Code of Practice, let's take a moment to reflect on what they are and why they are important. A Code of Practice is a document that provides practical information about a specific work health and safety topic. It sets out the how-to on how to achieve compliance with legal obligations. Following Minister approval, a Code of Practice has legal effect and it is admissible in court. They can be used as evidence in court of what is known about a hazard, risk or control, and to determine what is reasonably practicable. So in October last year, the Commonwealth's very own Managing Psychosocial Hazards at Work Code of Practice was approved, and it is in legal effect within our jurisdiction as we speak. Up until it was released, we did rely on guidance from our trusted colleagues over at Safe Work Australia, who developed the model code, which the Commonwealth Code is based on. The Commonwealth Code supersedes the model code because it has minister approval. Now, the Commonwealth Code, which I'll refer to now on as the Code, is one of the most important documents to be across regarding psychosocial hazard and risk management because of the detailed practical guidance it provides on how to achieve compliance. Following the approved code will assist duty holders to achieve compliance, and a duty holder must demonstrate that they are following an equivalent or higher standard than outlined in the code. Comcare inspectors have a very high level of regard to the code when conducting psychosocial inspections because it sets out the standard that's expected. If you ever feel overwhelmed by the suite of resources available out there, I recommend starting with this one. Whilst our code is largely reflective of the model code, there are 4 key differences that are important to be aware of. The first is that there are 3 additional hazards: intrusive surveillance, job security, and fatigue. This means there are now 17 identified psychosocial hazards, with the other 14 being the exact same as is in the model code. The second is that the code reinforces the requirement that PCBUs must follow the hierarchy of controls to manage the risks from psychosocial hazards. This was not a requirement under the model code. Next is that it introduced 10 principles for duty holders to follow when responding to psychosocial matters. These are entirely new. And lastly, 5 case studies to demonstrate practical application have been included in the code, and let's go through each of these very briefly. Starting with intrusive surveillance. This refers to excessive surveillance methods and tools to monitor and collect information about workers at work for the purposes of work performance monitoring. So intrusive surveillance is about excessive monitoring for work performance. It includes tracking when and how much a worker is working through tracking calls, keyboard activity, and their movements. And it has a resemblance to micromanagement. It is important to distinguish this from general monitoring of performance that is appropriate as part of reasonable management action. Surveillance is likely to be considered intrusive where the monitoring is excessive, it impacts worker privacy and autonomy, and leads to punitive action. Now, the code details example controls for all 17 psychosocial hazards, and it is up to the duty holder to ensure that they consult with affected workers when determining the most appropriate controls. But some example controls for intrusive surveillance as outlined in the code include genuinely consulting with workers about the introduction, implementation, and use of performance monitoring systems, having a clear policy on monitoring that is fair and not excessive, and ensuring supervisors understand their role in monitoring and are appropriately trained. Last point to mention here is that the code makes it very clear that surveillance of workers at work, such as through tracking geographical location, is appropriate when it is for work health and safety purposes or managing IT or security risks. Next, we have job insecurity, and this refers to employment where workers lack the assurance that their jobs will remain stable or where workers are engaged in insecure work arrangements. We know that a lack of clarity about employment can cause stress and anxiety, and it can result in workers taking on more hazardous tasks, working extended hours, and being tolerant of unsafe working conditions due to the fear of losing their employment. On the right of the screen are some examples taken directly from the code on how to control the hazard, and includes consulting and providing advance notice of work arrangements, especially if contracts are not going to be renewed, and enabling workers to have input about work arrangements and hours. Lastly, we have the hazard of fatigue. This refers to a state of physical or mental exhaustion, or both, which reduces a person's ability to perform work safely. It can be caused by work that involves high physical, mental, cognitive, or emotional demands, or poor environmental conditions. It is well established that fatigued workers experience reduced reaction times, impaired decision-making, and decreased resilience levels, which significantly increases risk of harm. Looking at the right of the screen, we have some examples taken directly from the code on how to control the hazard of fatigue, and this includes having fatigue management plans, training to recognise signs and symptoms of fatigue, and establishing hours of work and rostering to ensure adequate time to rest and recover. Now, we often get asked about why fatigue is its own hazard, given that fatigue can be an outcome of job demands. And this is true. They have a strong connection. However, fatigue can also result from experiencing other work-related factors or hazards. If we drill down into the definition of the two, the hazard of job demands refers to the experience of prolonged and challenging high or low effort, whereas the hazard of fatigue is about managing the risks that come from being in a state of physical or mental exhaustion. So whilst similar, it requires consideration of slightly different factors, and these are described in the code. All right, now moving on to the hierarchy of controls. The code and regulations state that the hierarchy of controls must be followed if it is not reasonably practicable to eliminate a psychosocial risk. It means that risks from hazards must be eliminated first, and only if it is not reasonably practicable to eliminate all the risks, other controls must then be implemented and prioritised in accordance with the hierarchy on the right of the screen there. The hierarchy ranks control measures from the highest level of protection and reliability at the top to the lowest down the bottom. The code has detailed guidance on how to follow this process. However, to demonstrate a basic example today of how this could be applied, let's take a look at one of the most common hazards we see, job demands. So starting with the first step, elimination. For psychosocial risks, elimination means completely removing the psychosocial hazard and associated risks, often through good work design. So for job demands, this could include designing work or roles to have manageable responsibilities, to ensure workers have an appropriate amount of work to match their skills and experience, to remove unnecessary tasks, and to ensure adequate staffing levels. If the risks still remain after implementing elimination controls, you must consider either substituting the hazard with a safer alternative. This could be distributing workload among team members to ensure they're doing a mix of high stress and low stress tasks, isolating the hazard from the person, for example, providing access to quiet spaces if they regularly require to be in busy and loud environments, or engineering controls, which could include introducing software tools to streamline workflows, prioritize work, automate tasks, or reduce administrative burden. And it may be appropriate to use a combination of these controls. If risks remain after elimination, substitution, isolation, and engineering controls have been applied, next is to consider administrative controls. Administrative controls commonly include organisational policies and standard operating procedures that are designed to minimise exposure to a hazard. They are considered to be less reliable because they rely on human behaviour. For job demands, this could include setting realistic deadlines and ensuring employees have access to resources and supervisory support to manage their workloads. It could also include providing training to ensure workers have the skills to meet the work demands. PPE is generally not applicable for a hazard like job demands. However, for other psychosocial hazards, it commonly includes things like having a personal distress alarm, a body cam, or protective equipment. From what we have just stepped through, you can see how following the hierarchy and its order ensures that the most effective controls are considered first to maximise harm prevention and minimisation. And a reminder, this is just an example for the purposes of today's session. PCBUs must ensure they identify and implement appropriate controls in consultation with their workers. Okay, so next is the introduction of 10 principles in responding to reports, complaints, or incidents related to psychosocial matters. The code provides specific guidance on this starting on page 39 and includes details on how to align practices to all of the principles you see on the screen here. There were several questions that came through in the registration about responding to psychosocial reports and the process for conducting investigations. Any work health and safety investigation involving psychosocial hazards should primarily aim to identify hazards or new or improved control measures. In the same way that you would with a physical incident, you may need to determine what happened, why, and what can be done to improve controls to eliminate or minimise recurrence. Applying the 10 principles as detailed in the code will help you to do this in a safe way, noting the additional sensitivities that may come with psychosocial matters. On a completely separate note, several questions also came in about controlling risks from management action and managing underperformance. And I thought it would be good to highlight that on page 37 of the code, it has some good guidance on this. All right, this brings us to the final point, case studies. The code details 5 case studies in managing different psychosocial hazards across a range of industries, including the construction industry, a large government call centre, a trucking company, a public sector department, and first responders. They include common psychosocial hazards and risks, example controls, and approaches to follow the risk management process. They are a great resource to give you an example of practical application, but remember, what will work for one organisation won't always work or be appropriate for another. Every organisation is unique, and the best way to ensure you maintain compliance is to follow the code and the risk management process in consultation with workers. Thanks for listening, and back over to you, Lachlan.
Thank you, Kathy, for breaking all that information down and showing us a really practical example of the hierarchy of controls. So I'm now going to pass on to Rebecca, a senior inspector, to discuss the Psychosocial Inspection Program. Welcome.
Thank you. Thanks, Lachlan, and thanks, Kathy. Hi, everyone. Today I'm coming to you from the lands of the Kaurna people. I'm a senior inspector in the Psychosocial Regulation team, and it's great to be here today to share some information with you about the Psychosocial Inspection Program. So this is a new Comcare program that will formally commence in May this year for employers within Comcare's jurisdiction. The program involves conducting an inspection of an employer's work, health and safety management system as it relates to psychosocial hazard and risk management. So the objectives of the program are to assess employer compliance with work health and safety legislation, strengthen leadership commitment to the prevention of psychological injury and illness, uplift the capability of employers to identify and manage psychosocial hazards through the provision of information and advice, gain insights into current and emerging issues or trends regarding psychosocial safety from across our jurisdiction, and facilitate collaboration and coordinate the sharing of information and good practice examples to promote continuous improvement. So in terms of what we will be looking at, Comcare will assess the psychosocial safety management system that an employer has in place. And this has a number of components, including the organisational environment, the work health and safety duties of officers at the workplace, the employer's psychosocial risk management process, consultation, cooperation and coordination at the workplace, and how the employer responds to psychosocial hazard reports, complaints and incidents. Now I'm going to briefly walk through the process of a psychosocial inspection. So in stage 1, employers are notified of their selection via email. Comcare will attempt to provide as much notice as possible with a minimum of 4 weeks' notice. Employers are also invited to complete an online pre-inspection form to provide us with some key details that will help us with planning the inspection. In stage 2, inspectors will meet with representatives from the employer's work, health and safety and human resources teams to gather information and insights regarding how the employer's psychosocial work, health and safety management system operates in practice. We will then ask for materials such as policies, procedures and other documents related to psychosocial risk and hazard management. In stage 3, Comcare will provide an online survey to the employer for distribution to all workers. The survey seeks feedback about the management of psychosocial hazards, including the effectiveness of controls, consultation, communication and training. Whilst on site at the workplace, Comcare will also offer a limited number of appointments for workers to meet with an inspector to go through the survey face-to-face if they wish. And individual survey results are kept confidential and may be reported on in aggregate in the final inspection report. In stage 4, Comcare will facilitate an in-person semi-structured session with senior executives to gather feedback regarding officer duties, psychosocial risk and hazard management in practice, and leadership commitment to psychosocial injury prevention. Stage 5 sees us having a virtual semi-structured workshop with health and safety representatives if the employer has them. And the purpose of these workshops is to seek feedback from HSRs regarding their experiences as worker representatives. And then in the final stage, Comcare will issue a tailored report to the employer outlining the findings of our assessment. If non-compliance is identified, this will be discussed prior to the report being issued. And the severity of non-compliance will determine the action taken, which will be in line with our compliance and enforcement policy. So for more information on the Psychosocial Inspection Program, visit the web address on the slide, and this link is also available in a copy of the slides, which is available on the Comcare website. So for organisations in the Commonwealth Work Health and Safety jurisdiction, you can request to take part in the Psychosocial Inspection Program, and you can email whs.help@comcare.gov.au with your interest, and we will consider your request as part of our selection process. However, don't wait to be chosen or to volunteer, as there is a lot that you can do right away to ensure that you are compliant. And Kathy has already spoken to some of these, but here's a quick reminder. You can read the Work Health and Safety Act and regulations to be clear on your responsibilities. You can read the Code of Practice for some practical examples of types of controls that you would consider for each of the 17 psychosocial hazards. Please develop and continue to improve your workplace health and safety systems, ensuring their relevance to psychosocial risks. Ensure you have ongoing and meaningful consultation with workers, HSRs and other duty holders, and remain informed about current or emerging risks in your workplace and across your industry. So thanks so much for your time, and I'll hand back over to you, Lachlan.
Thank you, Rebecca and Kathy. Thank you for all of those who are popping into the Q&A at the moment. In a moment, we're going to move into the audience discussion using Mentimeter, which has just appeared on the screen. You can join using a phone with the QR code, and there's a link in the Q&A function for easy access on a laptop. While you're opening Mentimeter, I'll share that the Comcare website is home to so many resources and links to partners' work that can support you and your organisation to manage your psychosocial risk. We have a few pages that have collated information on psychosocial hazards and how to manage them. And this includes more information about the 3 additional hazards that Kathy mentioned earlier: intrusive surveillance, job insecurity, and fatigue. And for more information, Comcare's Learning Management System, or LMS for short, has a range of education e-learns that are free to access, including our e-learn Introduction to Psychological Health and Safety in the Workplace, and our micro-learn series on the Comcare Code of Practice, which we've been discussing today. You can also register for our live learning workshops and presentations on psychosocial risk. In the future, we'll also be releasing new e-learning courses, including bullying and remote and isolated work products. If you're not already subscribed to Comcare's e-news, the link is also in the Q&A function. By subscribing, you'll get updates when there are new educational products launched and for upcoming events and other important updates as well. The slides for today's presentation are already available on our website, and the resources we've spoken about are linked in the document. See the pinned post in the Q&A function for the link. Just a reminder that the recording of this session will also be available on our website in the coming weeks. So let's move on while we're waiting for Mentimeter to get started. This year at Comcare, we're running our National Work Health and Safety Awards. And let's hear a bit more about the awards from our acting Deputy CEO, Megan Buick.
Nominations for Comcare's National Work Health and Safety Awards are now open. The awards recognise and reward excellence in workplace health and safety, recovery at and return to work, achieved by employers and individuals operating across the Comcare scheme. Across all categories, we're looking for nominations that demonstrate above and beyond best practice, significant and ongoing impact and innovation. Nominations close on Wednesday 30 April, with the winners announced at a gala dinner in Canberra in November. If you need help along the way, contact our awards team or visit our website for more information.
So due to some not being able to view the video properly, I'll just provide a quick overview for you. If you want to watch the video later, it's available on our website on the Health and Safety Awards page. So Comcare holds a biennial, so every 2 years, Work Health and Safety Awards, and the next one is happening in 2025. The awards recognise and reward excellence in workplace health and safety, recovery at and return to work for employers across the Comcare scheme. So 2025 is a significant year as it marks the 20th anniversary of the awards, and nominations are open now until 30 April 2025. You can refer to the pinned post in the Q&A for more information. All right. So now I'd like to hand over to you, the audience, to look at your responses in Mentimeter. So if you haven't already, please join us via the Mentimeter website using the code that has previously been provided and should be popping up on the screen soon. Please note that your responses in Mentimeter are anonymous, and also please make sure you don't include any information that can identify you, your organisation. We'll be using this information gathered from this session to help Comcare better understand where organisations are currently at with managing psychosocial hazards. It will also be used to support the development of future webinars, resources, and in development of Comcare's prevention and return to work action plan. So if you haven't already completed question 1, please respond now. Which work health and safety jurisdiction are you in? And I can see a lot of people are answering from Comcare. We've got quite a few from New South Wales and WorkSafe Victoria as well. But what's wonderful is seeing an Australia-wide response, which is really fantastic. So completing the first question will then prompt you to our next question. We've moved to now. Now, this is a quick multiple choice. What is your primary role or responsibility at work? We'll give you a few moments to pop in your answer there. Straight away, we've got a lot of work health and safety practitioners. Also, quite a few health and safety reps. Welcome, lovely to see you along. Managers and HR practitioners as well, coming along as well. So lots slowly ticking up those responses. It's really fantastic to see a really diverse set of roles and responsibilities coming through. So let's now move to the next question, and it's around good practice. So the question we'd like to ask is, what is working well? So working well in your organisation to manage psychosocial risks. So have a think of from your perspective as a worker or as someone who has visibility over work health and safety in your organisation. What have you seen that's working well? And try to explain or describe it in a few words or less. This could be something you've observed. It could be a program or an initiative or an example of elimination, substitution, engineering, isolation, administrative control, or even that elusive PPE that you've seen to be effective. It doesn't have to be a control. Could be a worker consultation tool or a technique to communicate about psychosocial hazards or a leadership approach you've seen. And this is a great opportunity for you all to hear from each other about what is working well. So from a regulator's perspective, good practice aligns with what's described in the code, and in particular, correctly following the risk management process. So genuine consultation with workers is something we see often gets overlooked, and organisations who have genuine mechanisms in place to seek feedback from workers about the management of risks that affect them generally have robust safety systems. Another good practice that we've seen is where organisations integrate psychosocial risk management into their existing safety framework rather than treating it as a separate issue. So it's scrolling past very quickly, but if you see anything here today that you think could resonate with your organisation, please take note. Go back and review the video later and take any snapshots and please implement in your workplace. But remember, follow the risk management process. So we're slowing down here, so we might move to the next question. This is a follow-up question, looking more broadly at approaches to prevent injury and illness. What else is working well in your workplace outside of psychosocial risk management? For instance, this could be an example of a program, activity, or initiative in your workplace that's broader, more broadly focused. And we'll wait just a few more moments before moving to the next question. What's really nice is we're seeing a top and bottom response here from policies and procedures to good team meetings and consultation here as well. Training coming in there, awareness, use of those supporting systems such as EAPs, and some of the things like flu shots coming in as well. So lovely to see, and coming from the education unit, lovely to see all of that training popping up in the chat as well. So let's now move to the next question. I think it's starting to slow down there. So over to you, Kathy.
Thanks, Lachlan. All right, so the next question's a quick one. As an individual, how would you rate your understanding of psychosocial risk management? So do you feel very confident, neutral, somewhat confident, or not confident at all? Already I can see quite a high level of confidence, but some mixed levels amongst the cohort. Give you a couple more moments with that one. All right. So with the mixed levels of confidence, for those who haven't rated as confidently, a reminder that Comcare has a suite of resources and training material available to support you. And hopefully we have enough time at the end to sort of hear from you as to if there is anything Comcare can do to better support you. I think we might move on to the next one.
Sure, thanks. Thanks, Kathy. So the next question is, what hazards are most present in your workplace? And you can select more than one answer for this one. And when answering this one, think about what psychosocial hazards are most present. And it includes hazards that are present, but that have well-controlled risks, as well as ones that you think might not be well-controlled. For example, you could be in a role where you respond to distressing calls, but there's a good framework in place for regular managerial support, regular breaks are built in, and the work can be broken up with non-demanding tasks. So yeah, with this question, we're really just trying to get a sense of what hazards are most common within our jurisdiction. It is quite small on the screen, but I am seeing that I think job demand seems to be coming out on top at the moment, which is quite consistent with our current understanding as well. We've got poor organisational change management is another big one, conflict or poor workplace interactions, and fatigue. So that's one of the hazards that's just been newly included in the code. So it seems like the top three are at the moment job demands, poor organisational change management, and the conflict or poor workplace interactions and relationships. So that is quite reflective of what has consistently been coming up as some of the hazards of high concern. So this is also really good information that we can use when we conduct our inspections and also when we're developing resources.
Absolutely.
It seems to have slowed down, so I'll just pass on to the next one.
Yep, certainly. And thank you for that input. That's incredibly useful for us as well when looking at our products and assistance that we provide. So question 7, what hazards are you or your organisation most concerned with? So this is a free text, but the difference between this question and the last one is that we want to understand what your organisation is most concerned with rather than what's most present. These things are sometimes very different. So, for example, you might find job insecurity is most present, but your organisation is concerned mostly with bullying. And I can see bullying right centre with the word cloud that's popping there. It's free text. You can submit more than one response. So, and what's wonderful is I can see those coming through and really filling up the screen there. And I'm just going to give you another minute or so to go through, and you can see with some of those, as you've added the same words, that will actually bring those to the fore as well. So the big ones seem to, as the previous slide talked about, those present, highlights job demands, but we've also got bullying, fatigue, change management, violence and aggression coming in there. Fatigue and conflict seem to be swapping places a little bit, and so many responses just ticking through at present. It's really wonderful to see. So with that, let's move on now to our next question. Rebecca.
Sure. So this one is, how effective do you think your organisation is at managing psychosocial hazards? We've got a lot of answers coming in straight away. Sitting around the middle at the moment, moderately effective. Sitting in the middle there. Yeah, so effectiveness is a really interesting one because there's so many different factors that can influence this, and it's also a great one to reflect on as an employer because it's looking at what may or may not be working in practice. So the policies and procedures that you have, are they being actioned effectively day to day on the ground? Are hazards being identified? Are the risks reduced because of actions that are actually being taken? So this is where consistent monitoring of hazards and control measures is really important, as well as consultation with workers to determine what is working and where improvements can be made. So yeah, it seems like we've sort of stopped around it going up to moderately effective being where most places are sitting. So yeah, really encourage you to look at the actions that sort of come out and that might need to be reviewed in consultation with all your workers in increasing that effectiveness. And I'll pass back over to you, Lachlan, I think, for the next one.
Excellent. So looking at question 8 now, this is again a follow-up from previous questions, but it's also a free text that you could submit multiple answers if you wish. A reminder, please do not include any information that can identify you or your organisation. So what are the barriers to managing those hazards? So we all know managing psychosocial hazards isn't always straightforward, and there can be a variety of obstacles, whether it's lack of resources, insufficient training, or even organisational culture. And I can see some of those, work demands, workload, workplace cultural attitude popping up there, lack of understanding or lack of training, lack of resources also popping in there as well. Wonderful. Looking at capability, sort of matching up with that understanding, people, and of course, the culture of an organisation seems to be popping up in there as well. Really fantastic responses. Let's move on to the next question.
Thanks, Lachlan. And thanks for sharing all of your insights thus far. It's been fascinating to have a look. And off the back of that last question, another open-ended one for you. Is there a hazard your organisation needs more guidance and support on to manage? So please take the next few moments to reflect and type in your thoughts of what hazard could your organisation benefit from more guidance or support in managing. And this can be anything, a psychosocial hazard, a physical hazard, or any other challenges your organisation is facing. So please let us know, and I can see quite a few responses coming in there. So thank you. This is very valuable for us to be aware of so that we can take this into consideration when developing future content for resources or for webinars. And we might just give it a few more moments as the responses come in.
Seeing a lot of bullying popping up there. Like I said, stay tuned. We will very soon be releasing an e-learn on bullying. So hopefully be able to answer some of those questions that are appearing in the chat as well.
Yeah, great. All right. Few more moments because I can see everyone's busy putting in content, which is great. Thank you. All right. I think we're just about there. Almost ready for that next one.
Wonderful.
Thanks all.
So thank you so much for your really valuable responses so far. And we've got one final question for you today. So in addition to guidance and resources, how else could Comcare support your organisation to manage psychosocial hazards in the workplace? Just a reminder, we have those links of our guidance and education in the Q&A function. But this is really your chance to think about additional ways for Comcare to support safer and more supportive environments, whether it's through training, tools, strategies, or even partnerships. We'd love to hear your suggestions on how we can provide more targeted support. So I can see some thoughts popping into the text boxes, and we're really excited to see all of these responses as well. So I saw investigations pop up there, more case studies, got those voluntary audits that's popped up there. So specific webinars, it's really good to know. More e-learning, again, wonderful to know. Training packages. Wonderful. Some really, really fantastic and very valuable input, and your feedback is incredibly important to us. So we're just coming up to the end of time now, and we seem to have slowed down a little bit. So we might wrap up the Mentimeter session here. And the last thing that we'd like to do before we end today's session is to ask you to complete a short 2-minute evaluation survey using the QR code on the screen, or access the link in the Q&A post. We're also going to send this via email to you, but if possible, we encourage you to open the survey now and respond before logging out of the event. This is an opportunity to tell us what you want to hear more about. What are your topics of interest as well? Is there an expert that you'd like to hear from, and how we can make these events even better for you? Finally, if you're a HSR, a health and safety representative, or a deputy HSR in the Comcare jurisdiction, you can join Comcare's HSR network to receive the latest HSR news, events, updates, and information. If you're in the Comcare Health and Safety jurisdiction, you can contact the Health and Safety Help Desk at the link on the screen there, whs.help@comcare.gov.au for more information. I mentioned throughout the forum, the session has been recorded and a copy will be posted on Comcare's websites in the next week or so, along with the presentation slides and any relevant resources. We'll also send out an email to let you know when this is available. I'd like to thank all our presenters, Kathy and Rebecca. Thank you for joining us today. And thank you, the audience, for taking the time to participate and providing us with invaluable information about our jurisdiction. We hope this forum has provided you with some insights and key takeaways. Thank you again for joining us, and have a great day. Stay safe.